afternoon, and thank you for joining the Superior Health Quality Alliance Nursing Home Leadership Roundtable, where we are continuing our series in turning your deficiencies into efficiencies, F884, reporting in NHSN. My name is Constance Tetrov, and I am a Superior Health Quality Alliance, and I am here accompanied by a few of my colleagues, Ms. Mykesha Plesko, Tabitha Meyer, Margaret De Oliveira, as well as our guest speaker, Ms. Elena Blair. We host these one-hour sessions on the second and fourth Wednesday of the month. The first half is a didactic presentation, and then the remaining time will be used for questions and answers. The PowerPoint presentation link will be dropped into the chat momentarily. Please use the chat box to share any comments, questions, and even resources during the presentation. Besides learning from our speakers, we learn from each other and our peers, so we look forward to those comments and questions. Towards the end of today's event, we will also put an evaluation link in the chat that will only take you a few minutes to complete. We use that evaluation to help us give you a better experience at these roundtables. Today, we have one of our amazing colleagues and leads here at Superior Health Quality Alliance, Ms. Elena Blair, presenting on F884, reporting to NHSN. Please help me in welcoming Ms. Elena Blair, and we look forward to you sharing your knowledge and experience with us today. The floor is yours, Ms. Elena.
Thank you so much, Constance. I appreciate it, and welcome everyone to today's call. As Constance mentioned, I am one of our Superior Health Quality Improvement Advisors. So I'm going to talk to you a little bit about F884 and how you can kind of avoid getting this tag and maybe what Superior Health can help you with. So to get us started, just talking a little bit about our objectives, we're going to understand the F884 tag after the end of this call. We're going to learn how to avoid that F884 tag, and then I'm going to describe how to make your National Healthcare Safety Network or NHSN reporting more efficient. But before we hop into all of that, I kind of want to get an idea of where we're sitting right now. So what we're going to do a little bit today is do a almost pre and post quiz here, but it's nothing that serious. We won't look at what your individual answer is. We're just kind of looking at the group. So my first question here is going to be, which items are you required to report in NHSN on a weekly basis? Is it the positive and negative COVID-19 tests along with staff and resident vaccinations? Is it positive COVID-19 tests, resident vaccinations, and the surveillance pathway? Is it positive COVID-19 tests, staff and resident vaccinations, and the surveillance pathway? Or is it positive and negative COVID-19 tests, staff and resident vaccinations, and the surveillance pathway? I see those answers coming on in, and I will warn you right away, I'm not going to tell you the answer right off the bat. Once we get to the end, you're going to be asked this question again, and we'll hope to see that more of you are understand what the requirements are as a result of this PowerPoint. So I'm seeing that about half of you have answered. There we go. We're popping up a little bit more. We'll give it just another minute to make sure that you all have the opportunity to answer this one for us. And I can tell that most of you are getting it right. So that's a good thing to start off with, but there might be a few of you who need some clarification here today as well. So that's not a bad thing either. That's what we're here for. All right. I see that about 20 people have responded. So we are going to end the poll and continue on with the presentation here. So let's get started with the definition of this F tag. So this F tag was initially released back in May of 2020. And there's the QSO, and we'll have that linked at the end as well in case you want to take a look at it. But the initial focus of this F tag was actually on COVID-19 testing, total deaths and COVID-19 deaths, PPE and hand hygiene supplies, ventilator capacity and supplies, resident beds and census, access to the COVID-19 testing while a resident is in your facility, and staffing shortages. So if you remember all the way back to 2020, those were the things that we were concerned about. We didn't even have a vaccine quite yet. So along with that, some of the things that were spelled out in this memo remain consistent to what we're having to do today. So for examples, facilities must submit resident and staff COVID-19 data through the NHSN reporting system at least once every 7 days. The once every 7 days piece is still active today. You're probably very familiar with that. Facilities may choose to submit multiple times a week. You can still do that today. You can update your data throughout the week, all of that good stuff. CMS did not prescribe which day of the week the data must be submitted, although reporting should remain consistent with data being submitted on the same days each week. And then that collection period will also remain consistent, which is Monday through Sunday. And that piece has remained consistent. The reporting week does go each week from Monday to Sunday and then starts back over again. But the one thing that we'll talk about a little bit later as well is that when this first came out, a lot of facilities decided that they were going to report on Sundays. And one of the things we're going to talk to you about a little bit is why that might not be the best day of the week to plan to report all of your weekly data. But when this first came out, a lot of people thought that that's what they had to do because that's when the week ended. And they thought that they needed to put their data in on Sunday because that was going to include all of that week's data. So we'll talk a little bit more about that, but both of those things are still active. And then each Monday, CMS reviews the data submitted to assess if each facility submitted data at least once in the previous 7 days. And then they do publicly report all of this data as well on the data.cms.gov website. So a lot of similarities. The main things that are different are what you are all reporting. So another update was made, and this is the one that brought us more closely aligned to what you're doing right now. And that was the QSO from May 11th, 2021. So we have had our vaccines for about 6 months at this point, and CMS and NHSN added long-term care facility vaccine immunization requirements for residents and staff. So directly from this QSO, it reads that it requires LTC facilities to report on a weekly basis the COVID-19 vaccination status of residents and staff, total numbers of residents and staff vaccinated, each dose of vaccine received, because at that point in time, it was a primary series, so they were likely receiving 2. COVID-19 vaccination adverse events and therapeutics administered to residents for treatment of COVID-19 through the NHSN's LTCF COVID-19 module. So a lot of that is still something that you're doing, especially when we were talking just about reporting vaccination status of both residents and staff, but it continues to evolve even through today, what it means to be vaccinated, what it means to be up to date, which we'll get into a little bit more. And then facilities must continue submitting their data, that COVID-19 data to NHSN at least weekly, but no later than Sunday at 11:59 p.m. each week. So that remained consistent and continues to this day. And that started on June 13th, 2021. So for some additional background, we're going to talk a little bit about why the F-tag is important. So initially, that data was reported for a way for CMS to know where new resources or more resources were needed. So when we were having PPE shortages, this was a way for nursing homes to say, we need help, we're really, really low on these things, so that the government could kind of make sure that we were trying to help those who were most in need. So those types of things, those were the reasons why we were putting that information in. Now that we have those resources, we're really putting this information on positive tests and hospitalization and vaccination rates into NHSN to help CMS and CDC and the government identify improvement. So when a new vaccine comes out, how quickly is it getting to our nursing homes so that they can have mobile clinics and we see rises in their rates for both staff and residents? Really helps them identify, okay, how many outbreaks are happening that are causing hospitalizations, things like that. That's why we're putting this information in here. Now, the reporting requirements do change, and I'm sure you're all very familiar with that. You have to kind of make sure you're keeping track of those changes because they are going to reflect the guidance that changes. So for example, when COVID-19 up-to-date definitions change, typically during the next quarter, CMS is going to make changes or NHSN is going to make changes to reflect those guidance changes. And we'll get into that a little bit more too. The last thing we just want to chat with you all about is that Superior Health Quality Alliance is your quality improvement organization. That's myself and the team that Constance introduced a little while later. And we're a resource for ensuring you are reporting everything you should be reporting. And we help ways to find things that you can do to make your reporting more efficient. So we're here to help you out. And that's part of why we're coming on today to talk about this tag. So the F tag, F884, is the most popular tag to get across our 3 states. So as you can see here, in calendar year 2023, it was given 457 times in Michigan, 408 times in Minnesota, 257 times in Wisconsin. And then you can see kind of the progress that's already being made on this and how many have been given out thus far in 2024. And I think this data ends in like mid-February is when we pulled this. Now, across all 3 states, there is nothing surprising here. This is the top reported tag for both calendar year 2023 and thus far in 2024. So this is a big thing that's happening to a lot of facilities, and we're going to talk about how you're getting these tags and what you can do to avoid them. Now, across all 3 states, the next 2 top tags were F884, which is free of accident hazards / supervision / devices, which had about 364 in 2023, which if we go back to this one, you can see that that's much less than any of these. And that was across all 3 states. This is just one state. And then the next one, the next highest was F884, which was quality of care, which had 275, excuse me. So as you can see, this is a big tag that's being handed out. It's getting to a lot of facilities across our 3-state region, which is really why we wanted to make sure that you have some strategies to use to avoid this one. So what happens if you fail to report? Well, you're required to report that once weekly. If you fail to report for 2 weeks in a row, you will receive a warning notice, failure to complete NHSN COVID-19 reporting via Casper. So you'll get that scary notice, and it will have a bunch of different instructions on it or explanations for what they can do. And one of the things that they can choose to do is impose CMPs for each week of noncompliance. And that would start at $1,000 for the first week, and then it could increase by $500 increments for each subsequent week of noncompliance. Now, I haven't necessarily heard that anyone has gotten a civil money penalty. I don't know if any of you have ever heard of anyone getting a civil money penalty, but if you have, you can feel free to put it in the chat. Doesn't mean that it was you, but it'd be interesting, I think, for other nursing homes to hear if you've heard of other nursing homes getting a CMP as a result of the F884 tag. But as you can see, even if we haven't heard of anyone getting a CMP from not reporting, it is in their toolbox. They could use that at any point in time. So it's really important that we just make sure that we have plans in place to always report on a weekly basis. So let's talk a little bit about preventing and avoiding the tag. So first off is, what do you need to report weekly into NHSN? So the first thing, and I took a screenshot and we're going to do a tutorial here too, but the first thing is the surveillance pathway. So this is going to be called the pathway data reporting. That's the button you'll click when you get into NHSN. And this is going to be the one that's going to ask you about positive tests, the total number of positive tests, hospitalizations, and things like that. That's what that's going to be asking you each week. Now, the next thing that you need to report are positive COVID-19 tests. So effective April 4th of 2022, and you can click on that link to get the full information, but reporting negative test results, either individual results or in aggregate, is optional. So right now, all you have to report, all that you're required to report is positive COVID-19 tests, not negative COVID-19 tests. And then lastly are our staff and resident COVID-19 vaccinations, which you can see where all of those are located there on the screen. And there are a few different ways that you can report that information. Maybe you're using the person level COVID-19 vaccination forms, or maybe you're going the more initial standard way where it just asks you the questions and you fill in the aggregate information. So those are the things that you are required to report weekly into NHSN. So if you remember, that was our first polling question. You're going to see it again toward the end here. So what does it mean to be up to date? And I want to preface this slide with, by the time we had to finalize these slides, some new information came out. So what is listed here on this slide is overall correct, especially given what you're inputting in NHSN, because again, NHSN typically does not update their guidance and what their definitions mean until there is a new quarter where they might do that. So every quarter, they look at everything and they say, we need to update this based on the new guidance, but they typically will not do that in the middle of a quarter. And right now we're more so at the end of a quarter. So up to date currently in NHSN means that you have gotten an updated 2023-2024 COVID-19 vaccination. Now that COVID vaccine, that new one, was released on September 11th, 2023. And what happens when a new vaccine is released is the government says to all of the people that provide those vaccines, get rid of all of your old vaccines. The ones that were the bivalent vaccine was the last one that we had. Do not use those anymore. Don't give them out to anyone. And we're going to be rolling out this new vaccine, and that's the only one that you can start giving. Okay. So what that means is that if you have anyone who has gotten a COVID-19 vaccine since September 11th of 2023, it means that they got this updated COVID-19 vaccine, this 2023-2024 vaccine. And what that means is that in NHSN, that means that they're up to date, okay? So any COVID vaccine, like I said, anything that they received after September 11th counts towards being up to date. Now, it didn't really matter if they've gotten a primary series in the past, if they got the bivalent vaccine. All that matters is that they got this new vaccine, the updated 2023-2024 COVID-19 vaccine. They don't care about any historical information at this point. We're just looking for that one vaccine. Now, the new information that just came out, maybe in the past week or week and a half or so, was that CMS came out, or CDC came out and said, and this will be on this source link that you'll see down here, this new language will be included on that. It's a great source of truth. That's my favorite website, that Stay Up to Date with COVID-19 Vaccines website. What you'll find there is that just recently, CDC updated that to say that people that are 65 years of age or older should get an additional dose of COVID-19 vaccine. Okay, so when they use that word should, that means that is their new recommendation. And what we might see, and I don't make the rules, I don't make the changes, but you could anticipate seeing that new should get and that new kind of guidance for what it means to be up to date as a person who is 65 years of age or older. We could see that get implemented in the next quarter in NHSN. So just keep your eyes peeled for that. They usually will send out that information. They'll have webinars. We'll make sure to get that information out as soon as we might see it. Again, I can't guarantee that that's going to happen, but it could. And I like to put that out there for you just to keep your eyes peeled for it. Now, the other thing that you would see when you go to that Stay Up to Date with COVID-19 Vaccines webpage is that it will reference people who are immunocompromised. And the difference there is that for immunocompromised people, the CDC says that they may get an additional dose. So those two words are pretty telling. CDC is using may in a way that's saying this is not required. They can choose to do it on their own, but CDC using the term should for people 65 years of age or older kind of pushes us into the realm of, okay, this could be an added guidance that we might see in NHSN in the future, because they're really saying that potentially we're going to see up to date is synonymous with, if I'm over 65 years of age, getting an initial dose. So a little confusing because what you're reporting in NHSN may not match up perfectly with this website, but eventually it could. So continue doing what you're doing, but I wanted to make sure that you were aware of what all that means. So without going too much further, we are going to do a quick tutorial of NHSN. So let me pull it up here. So we here at Superior Health do have a test facility, which is really, really nice. And it allows us to kind of go in and show you things. So there are some things that we can't do. I can't add in a COVID test and things like that. So I'm not going to go too in depth on that, but I'll show you where it is. And the other thing that doesn't fit perfectly with today's presentation, but I still want to make sure you know how to do, is reporting the annual HCP influenza vaccination information. So that is another requirement. It doesn't necessarily fit into this F884 tag, but it's something you have to report in NHSN. So I want to make sure you know how to do it. And that is going to be reporting your healthcare personnel's influenza vaccination data. And that's going to be from the time frame of October 1st, 2023 to March 31st, March 31st, 2024. And you're gonna have to put that information in by May 15th, okay? So you could start doing that now. You don't have to wait, but we'll do that kind of at the tail end of going through everything else because it's in a slightly different place in NHSN. So at this main screen, I'm gonna select the long-term care facility component. You're probably doing all of your work from there. That's no surprise, and submit. Now, the first thing I want to show you, because I think this is just important to have a good understanding of, is how you're able to add new people into NHSN. And if you ever need to make sure that someone is able to report certain things, you need to know who your NHSN facility administrator is. So the way that you do that is by hovering over facility and clicking on facility info. And when you get to this page, if you scroll to the bottom, you'll see this contact information section, and you'll see who your facility administrator is. So for this test facility, the facility administrator is myself. Now, this is important to know because if for whatever reason you learn about a new reporting requirement or a reporting requirement that you've never done before and you can't find it, oftentimes it could be that it's just not activated for you. And we'll talk about this a little bit more too, but for example, that annual HCP influenza reporting is done through the healthcare personnel safety component. Now, the only person that can activate this or follow it, as this is shown, is going to be the person who's designated as your facility administrator. So if for whatever reason you go in to try to report your HCP annual influenza vaccination summary and you don't have the healthcare personnel safety component, you probably need to talk to your facility administrator and ask them to activate it by clicking off on the box that's right here so that they end up seeing that blue check mark there, okay? So just something important for you to know how you can find out who has access to what and who can give people access to what. And we are going to be putting out a resource here shortly in the next few weeks that shows exactly how you can do things like find your facility administrator, activate components, give people more rights to be able to report things, things like that. So that would be the first thing I want to show you. The next thing I want to talk about is just your vaccine reporting. So there's a couple different ways. So these 4 areas are the areas where you could put your vaccine information in. So if we go to this COVID-19 vaccines HCP, this would be the first thing that pops up. And this is where you're kind of just adding the aggregate information in yourself. So you're saying how many employees were eligible to work this week, how many of them are up to date, and so on and so forth. The thing to remember for this is that questions 2 and 3, because these are 3.1, 3.2, 3.3, those must add up to the answer that you put in question 1. So just keep that in mind, okay? So this is going to look very, very similar whether you're doing HCP or residents. So again, you kind of add in your aggregate information there. And this is the same thing. The number of residents is your total number, and all of the boxes underneath it need to add up to what you put in question 1. Now, the other thing that I want to show you on this page, because this is a test facility, we don't always go in and put all the data in, but the other way that you'll be able to tell if you have submitted data for a week is by going to either one of these pages. You can go to the COVID-19 vaccination HCP, which we did, or you can go to the vaccination residents. It will show you this same page, but you'd be able to tell if you did report for a week is if your record goes from this kind of gray or this kind of yellowy beige color to this greenish color. So let's go back a week. You can kind of see that this one, okay, this one is complete because they went from this yellowy beige and now they're this green. Now, flu/RSV, you don't have to worry about. You could report that information, but that is not a requirement. So even though it's listed here, not a requirement. The only 2 that are required are COVID-19 HCP and COVID-19 residents. The other way that you might be reporting is through the person level vaccination forms, where you would have added your, at this point, I'm on the HCP page, added your healthcare personnel in here with all of their information, and then you're able to view reporting summary and submit, and then save and submit the data. And what we would see then, now that I did that, is I could go back to this page, COVID-19 vaccination. And what we will see is that it turned green because I reported. Okay, so it's going to look the exact same way if you do the resident side, where you can view reporting summary and submit, and it will also turn green. Now, if you're doing it this way, if you're reporting in this way, you wouldn't necessarily just be able to go in every single week and just press that button. You do have to keep it up to date, right? So if you add new residents or new staff, you're adding a row and including their information. If you're giving more vaccines out, you're adding those vaccines in here, but it's person level versus aggregate level at the last way that I showed you how to report. Now, the other thing within this that I will mention is that if you're using these person level forms, the nice thing that happens is that when guidance does change, when NHSN goes through those changes every quarter, this automatically is going to do the counting for you. So if they change it and they say, okay, if this person is 65 years of age or older, and they needed to have an additional dose of vaccine in order to be considered up to date, it has all of those people's birth dates, and it would be able to tell whether or not they got enough vaccines based on their birth date. Versus if you're doing it the other way and they make that change, for example, I'm not saying that they will, they could. If they make that change and you're doing it the other way, you would have to kind of keep track of that and keep your accounts separate to be able to input that information in. So that's one of the added benefits of person level forms. It's not for everyone. Not everyone loves this way of reporting. It would be really good if you're a super small facility. It might be more difficult if you're a really large facility having a lot of changes every week. So just keep that in mind. There are a couple different ways to report. If you're interested in one of these ways and you want to learn more, Superior Health team members are always available to meet with you one-on-one to kind of talk it through and learn what you're currently doing, and then help you figure out if this is a good option for you or if you should remain doing it the aggregate way, whatever that might be. So keep that in mind as well. The other thing that you report on that weekly basis is going to be our pathway data reporting. So this looks slightly different, but you're going to see that same thing where you'll have a green icon show up when you have reported for that week. Again, this is a test facility, so we don't always report because we don't have to, but you would see that change to that green kind of line within. So let's do one for yesterday. The facility capacity we said is 50 beds. So let's say we had 46 here. Positive tests, we only had 2 for this current week. Up to date, I will say we had 7 people that were up to date. Actually, no, we have a lot of our residents are getting vaccinated. So we'll say 44 of them are up to date. And then hospitalizations, we might put 0, and then 0 would automatically populate down here because I put 0. I believe if you put 2, you have the ability to change that up with hospitalizations who are up to date. And we'll say that 0 of them are up to date that were hospitalized. And then total deaths will kind of do the same thing where you'd be able to indicate if you don't put a 0 there. And then you just press save. Well, I might have done that wrong. It's going to show me right here. Let's see. I'm doing this wrong. We'll do 0 there because this needs to add up to, this cannot be more than 2. I apologize. So we can save it now. And now it turns green. So it will give you those alerts though, if you're doing something incorrectly, because things need to add up. It's going to meet the algorithm. But as you can see here, it turned green. That's how I know that I reported my pathway surveillance for the week. And you want to see one of those green icons once weekly. So every week here, every line, you want to see a green icon show up. Now, the last thing we want to go through is the POC test result reporting. So with this, I'm not going to be able to go super in depth with because we don't have a CLIA identification number because this is a test facility. So it won't let me actually add a test. But the nice thing here is that you are able to either add individuals in, or let's say you're using that person level vaccination form and you saw how we had all those people listed, you're able to find them this way. And you can select them. We're going to do Betty Boop, and all of her information will automatically be added. And then you'd be able to add a test result. Now, again, I'm not able to because we don't have a CLIA identification number, but you can kind of see what that process would look like. Now, if you don't have anyone listed or if the person you're looking for is not on this list of, residents or staff, you would be able to designate whether it's a resident that you're adding. You would add a resident ID for them. Tip for that is we don't want to use birth dates. We want to use super unique identifiers for this. So good ones for residents might be their medical records number, because that's going to be unique to them. A good one for staff is if they have a staff ID number, that would be a good one to use for them. It's not necessarily something you have to have memorized, because once you put them in here, you're going to be able to just find them this way by their name. But you really need to have that identifier be super unique. Now, the other thing I want to mention, I think that pretty much covers it for the required reporting in here. And feel free to pop any questions you might have while we're in NHSN so we can discuss them. But the other thing I mentioned that we are going to look over is the annual HCP influenza vaccination reporting. So what would happen is if your facility administrator has activated that component and you have the correct rights to access it, then you would be able to switch over to the healthcare personnel safety component from this main page and press submit. And then once you are in here, you'll just hover over vaccination summary, hover over annual vaccination flu summary, and click add. This should automatically be where you want it to be, and under influenza vaccination summary, you'll click continue. And then you'll just make sure that your facility ID is showing up correctly, vaccination type, influenza subtype, all those should be in there correctly, but just double check them. And then you'll select the flu season that you're reporting for. So you would be reporting for 2023-2024. So I have already done this for our facility, but as you can see, you are able to put in employees that are staff on facility payroll and all of their information, licensed independent practitioners, adult students / trainees and volunteers, and then other contract personnel. Once you add all of that information in there, there will be a save button at the bottom. Because I've already done this, I don't have that option. But once you put that information in there, you are going to be able to save it. You can go in and edit it at any time. So my suggestion would be get this done well before the due date of May 15th. You likely will already know who's gotten the influenza vaccine. It does go through March 31st, but if you're not going to be giving any more vaccines the rest of March, you could go in there and do this today. But let's say you do get some new staff members, or you do get some people that get the influenza vaccine between now and the end of the month, you're always able to click edit and change these numbers and just save it again. So you have plenty of opportunities to do so, and then you'll be able to tell when you last modified it because it's going to be listed right up in here. So any questions on that? And I'll let people unmute because I know that this was maybe new to some people. Last year was the first year that you may have had to do this. But any questions out there on this? Okay, not hearing any. We're going to flip back over to our PowerPoint here. We're going to talk a little bit about some strategies that you can use to make your reporting a little bit more efficient. So our first strategy, which we talked about a little bit right at the beginning of the PowerPoint, is picking a day of the week to report and sticking to it. So our team will always suggest to you a day earlier in the week, like Monday, Tuesday, or Wednesday. We don't ever want you to wait until the weekend to report because, first of all, we're not available to help you if you end up having questions. But also, if there are those technical issues, I'm also not sure how available the NHSN help desk is to help out. So Monday, Tuesday, or Wednesday are a best practice because you have some time the rest of the week, if you do normally report on those days and you have issues, to either reach out to the Superior Health team or reach out to the NHSN help desk for assistance. Now, how you would be able to make that switch. Let's say you're reporting on Sundays now, and you've been reporting on Sundays for years. All you have to do is, if you just reported this past Sunday, just report again. If you want to start reporting on Wednesdays and you just reported on this past Sunday, Then today you just go in and you report the information as of today. So you just reported on Sunday, you'll just report again today, and that's no big deal. The next week, you'll catch up on what you normally would have added for the rest of the week, the tomorrow through Sunday. You'll add that all in when you report all your information next week, Wednesday. So what you do not want to do if you're switching your reporting date is if you just reported on Sunday, you don't want to wait until next week, Wednesday, to start reporting, because then you're going to miss a whole week. So you are able to change the week or the day of the week that you report, and we highly suggest that you pick something earlier in the week. And then always be on the lookout for NHSN downtimes and readjust your date of reporting as needed. Now, reporting on Monday, Tuesday, or Wednesday also gives you the flexibility that if something comes up on one of those days that you typically report, you have a couple of extra days at the end of the week to still get your reporting in. We always suggest to try to put it in your schedule on a weekly basis so that you know, and everyone else at your facility maybe knows that on this day you are sitting down and you are putting the required information into the computer. So keep that in mind as well. The next strategy is going to be identifying a backup reporter and getting them their own login. So we always suggest be proactive. If your typical reporter leaves, you want to have someone else who knows how to report what is required for that weekly reporting. So reduce that burden on that reporter as well. If you get them a backup when they go on vacation, someone else is handling it for them. They can really take a break when they go out. And then you'll never miss a week, because if someone comes up on an unexpected medical leave or something else like that, you'll always have that backup person who knows how to report, and they have their own login information. The other part of this piece that we mentioned is get them their own login. You have to do a background check in order to get a login. So you do not want to have someone who is not you yourself using your login and doing anything incorrectly in NHSN, because ultimately they've looked into you, they've given this login to you. Everyone needs to have their own login. And it's pretty simple to do that login, and we can make sure that we put a link in the chat for how you do that, for how your facility administrator can give additional logins to people. But we highly suggest that you have multiple people that know how to report and that you have multiple people who have their own login. And then knowing who your NHSN facility administrator is. So I showed that at the beginning of the tutorial so that you can find who that person is, because they're going to be the people that can give additional logins to people, activate components if you ever need to do that, and all of that good stuff. Now, strategy 3 is creating a process for reporting. So maybe this is a checklist of some sort. That way, if you experience turnover or you have an unexpected leave of absence, if you have that process, someone else would be able to hop in and report on behalf of that person. Again, you would hopefully already have a backup person that knows how to do it. But if they need a refresher, they have this process to check into to refresh their memory. And you want to describe those 3 areas that are required weekly. So we kind of went over them in this PowerPoint, so you could even go through and add those to your process. And then explain how the team can find the numbers that need to be reported. So maybe you're gathering your HCP COVID-19 vaccination information from your HR team. So explaining that in your process, or explaining where you go within your system to find the individuals who've gotten vaccinated. Explain that in your process. And then ensure the team has easy access to the process. So is there a binder somewhere with this information? Is it somewhere? Is it a digital copy of this? Explain where that is and make sure that people know exactly how to find it. And then the last strategy that I'll go over is just knowing your options for support. So as I've mentioned several times, Superior Health Quality Improvement Advisors can help you with any questions you have with reporting. If you're not sure what the best options are, if it's person level, it's not person level, any of those things we can help you out with, and we can sit down with you one-on-one, have you share your screen, and we can look over it with you. And then if you have any technical issues, you do have to reach out to the NHSN Help Desk or this new ServiceNow platform. So if you're able to log in to NHSN, you'll use that ServiceNow platform. That's new. It allows you to kind of create a case and add photos to it. And then they get back to you much quicker than they used to when you just used to have to email. Now, if you cannot log in to NHSN, you would use the old NHSN Help Desk email address. which you can find by Googling NHSN Help Desk. And then it might take a little bit longer, but they will get back to you to try to help you out. If a technical issue inhibits your ability to report, take screenshots and include them in that help desk request. That's going to help you out immensely so that they can see exactly what's happening and so that you kind of have some evidence to show that if it truly is a technical issue that inhibited you from being able to report, that you have the evidence to show that you tried to report, you had every best interest in reporting, but then this technical issue made it so that you were not able to. Now, the other thing that I'll circle back around to, though, is that if you're reporting earlier in the week, you should be able to avoid having those issues because hopefully if there's a technical issue, you're able to get in touch with the ServiceNow platform, the NHSN Help Desk, get it corrected, and then still get in within that same week to make your required reporting deadline. So what happens if, even though you have all of this, things come up, people are out unexpectedly, whatever might happen, and you end up getting an F884 tag? We want to make sure that you do not miss reporting for another consecutive week. If you get one of those warning letters, make sure that your priority is to not miss another week. You go in right away and you add the data for the current week, and then you also submit the data for the previous reporting weeks. Now, why this is important is because, again, I believe it's on a quarterly basis. CMS and NHSN do quality checks. And in those quality checks, they might alert you to times where there's missing data, or if there were some data that made them think that it was incorrect. So maybe you go from a really high number to a super low number in between a couple of weeks. There's like 30% or 40% change between weeks. That kind of alerts them to, hey, check in on this data and make sure that it's correct. And then, as always, reach out to us for support. If you get one of these tags, let us know, and we can walk you through these steps if you've forgotten them since this presentation. So we're going to go over a couple case studies. I want to hear from you. So as I go through these, please feel free to chat your answers in or unmute yourself. This call is for you. We want to hear from you. So case study 1, Superior Nursing Facilities infection preventionist Donna recently left her position. Donna was the only person at the facility who knew how to report in NHSN. Lois, the new IP, wants to ensure the facility does not miss a week of reporting, but she doesn't have a login. Donna did leave her login prior to leaving the facility. Lois uses Donna's login to get into NHSN and report for the week. So what technically did Lois do wrong? I know that there are so many things that the facility could have done to help prepare Lois so that she wasn't put in this position, but what did technically Lois do wrong? I want to see some chats. I know you know. Or some unmuted. There we go. All right. Thank you, Jeanette. I appreciate that. She used Donna's login and you got that spot on. Again, like I said, there were a lot of steps that could have happened prior to Lois having to use Donna's login to avoid not reporting for a week. But overall, the thing we want to remind you all is that we want to make sure that people have their own logins and that you have a backup person in place so that Lois doesn't feel like she has to use Donna's login in order to put this data in to avoid a tag. All right, case study 2. Elizabeth is the director of nursing for her facility. She's also their NHSN facility administrator and typically does the NHSN reporting. Elizabeth identified a secondary reporter, Holly, the facility's assistant DON. She went through the process to get Holly her own login and gave her administrator rights within NHSN so Holly can access any area of NHSN should she need to. Elizabeth also created a process for their weekly reporting so vaccinations, positive tests, and the weekly surveillance reporting always gets submitted. Elizabeth goes out on an unexpected leave and Holly is prepared to take over immediately. So name some things that this team did right. There's quite a few examples. This is like a perfect scenario here, the things you want to do. Had procedures to cover for leaves and everyone has their own login, getting access for Holly. Beautiful. Thank you both, Teresa and Jeanette. I appreciate that. Okay, another one. Melanie is the administrator for her facility, and she is also the typical NHSN reporter. She has tapped a secondary reporter, Adam, the DON. Melanie typically reports every Sunday. She started doing so and just never really stopped. This Sunday, she tries to log into NHSN and realizes that NHSN is down. She missed the email from NHSN giving the heads up. What should Melanie do in the future? So she did some things right here. She tapped that secondary reporter. And while that was helpful, it didn't help her with this problem this week. Let's see. Report earlier in the week. Perfect, Jeanette. You're just getting an A+ in these case studies. Thank you so much. So yeah, try to follow along with those NHSN emails just to make sure you know when things are going to be down. But if Jeanette typically reported earlier in the week, she wouldn't have had to worry about this NHSN downtime. Typically, when NHSN is down, it's going to be over a weekend. And Teresa, I see your response as well. Thank you. All right, last case study here. Sunshine Nursing Home recently experienced complete turnover of their leadership team, including the person who typically reports into NHSN. Bill has been tapped as the new reporter. He wants to ensure he is meeting the requirements of reporting. Who should Bill reach out to? Could be a shameless plug for us. There we go. Okay, Mohammed, thank you. Superior Health, Teresa, thank you. Perfect answer. Please reach out to us if you ever have new team members that are going to be reporting. We can help them. I know sometimes with training and things like that, when you add new team members on who are going to be doing this, if you don't have the capacity to do that while maintaining all of the other things that you might be doing, we can help out with that. We can sit down one-on-one with a new reporter and walk through everything that they need to do so that they're prepared. So definitely keep us in mind if you ever need assistance. And it is all free. Anytime we sit down, I sat down with the facility earlier today, it's completely free. We just answered their questions and showed them how to do things. So with that, we're going to revisit our poll from earlier in the presentation. This time it is going to be more of a quiz. So I think it's going to tell you right away if you got the question right or wrong. So which items are you required to report in NHSN on a weekly basis? And it's the same answers as before. All right, I'm seeing people enter it in. Looking good thus far. All right, I see some improvement, so that is a good thing. We'll let that keep going. We'll give it one total minute. We got about 16 of you have answered this thus far. Once we get up to about 20 of you answering, then we will stop. So I need two more people to answer. And as I mentioned in the beginning, we aren't looking for individuals getting this right or wrong. We're just looking at the group of you. All right, this is looking like the vast majority of you got this correct. So the answer to this, and if it didn't already tell you, is going to be C. So the only thing that you have to report in terms of testing is going to be positive COVID-19 tests. You no longer have to report negative COVID-19 tests into NHSN. That was as of April of, I believe, 2022. It says in the slides back several slides ago. Might have been 2022 or 2023. In terms of vaccinations, you do have to do both resident and staff vaccinations. And then the last piece that you have to report is the surveillance data. So great job, everybody. I appreciate you taking that for us. Now, lastly, I just want to make sure that you have access to all of the resources that we shared here today, and those are all listed right here. We really appreciate your time. And if you ever have any questions, feel free to reach out to me or any other Superior Health QIA that you may have worked with in the past, and we can make sure that we get you the help that you might need with NHSN. So thank you, everybody. I really appreciate you participating whenever I kind of forced you to, but we'll take any questions you might have.
Thanks, Ms. Elena. Should organizations have a policy and procedure regarding NHSN?
I think that's a great idea to have a policy and procedure, especially when it comes to like naming mechanisms. So as we talked about when we were showing off kind of the person level side or adding in testing, when you have that ID, it is so important that you have it as a really unique ID, which is where we came up with the MRN or the student or not student, a staff ID number. So having that kind of written down in a policy, I think would really, really be helpful. And you could roll in some of those other things too. Now, the thing with NHSN is we know that it changes, right? So when you do create these types of policies, you might have to tweak them on a quarterly basis if what you're reporting into NHSN changes based on that guidance that they give you. But absolutely, a policy and procedure would be really helpful.
Great, thanks. Just a reminder, you can unmute too, and if you're on a phone, I think it's *6 to unmute.
Well, if anyone is chatting in, a couple things that we can just reference as well are that we do still have mobile vaccination services available across all 3 states. So if you are in need of a mobile vaccination clinic, they are free, and we do have complete regional across our whole region. We do have coverage, especially given that new guidance came out that stated that people that are 65 years of age or older should get an additional dose. If you're in need of help with that additional dose piece or any other doses, if you have new residents or whatever else, you just have been over capacity and you can't take on giving the vaccine yourself, reach out to our team and we can explain kind of what the options are in each state and let you know how it works and answer any of your questions. And we can make sure that we get you set up with a free mobile vaccination clinic. Now they can give both, they can give COVID-19 vaccines, they can give pneumococcal vaccines, and they can give influenza vaccines as well. Thank you, Constance, for dropping that in there. If you ever want to reach out to us about that, it's going to be immunizations@superiorhealthqa.org. And then, Constance, you want to mention our Vivint Health?
Yeah, additionally, we have partnered with Vivint Health for education modules on vaccinations. So we want to ensure that you have all that information. We can drop that in the chat as well. It gives you education on the pneumococcal vaccination, the influenza vaccination, COVID-19, of course, and I believe there's information on RSV. It's mostly geared towards the respiratory vaccinations. And I believe we just added that into the chat as well.
You can go to that link and you can enter in your nursing home's name and then fill out the additional questions there. And you can send that out to staff, residents, resident family members, and there are these interactive modules. You can check it out first. You can go in there and just take a peek. And if you like it, share it widely with whomever you would like. But it is attached to your facility. So you'd be able to kind of keep track as well as how many people from your facility have completed the modules or started the modules.
And we put that out in our e-blast as well as the nursing home information that it's on our website. So you can access it there too. Had procedures to cover for leaves and everyone has, oh, sorry, apologize, it went back. For vaccinations, are we reporting the week after since the data is for Saturday through Sunday? And we have to count any resident present for 1 day of that period. We often get admits and discharges every day of the week. If we report early in the week, the data for that time period would not be accurate. What would you suggest?
So this is a big reason why I think a lot of facilities were reporting on Sundays. But if you just consider, if you switch your date to a Wednesday, let's say you've been reporting on Sunday. So you just reported, I'm going to have to pull up my calendar, whatever Sunday was it the 10th? 10th. Let's say you just reported on Sunday the 10th. No, today. And you start reporting, you want to start reporting on Wednesdays moving forward. So you're going to go in and report today. So in this initial switch up, you'll just include those couple of days, Monday, Tuesday, Wednesday, in what you report. Now, next week, when you report again on the 20th, you'll do everything in that past week. So it is confusing. I totally get it, but I promise you that you can report any day of the week. And ultimately what CMS is looking for, I mean, you might have some of those smaller changes that are happening week by week, But overall, when you're going to have bigger changes are going to be when you have a mobile vaccine or you have a vaccination clinic and you have a big group of people who get vaccinated. So you're going to go from a low rate to a high rate. But it's totally fine to switch it up. You can just switch up what your weeks look like, right? So if you're switching it up to Wednesdays, you're only going to include a couple of days this first time. Even though NHSN module is pre-populated with set dates for the vaccinations, explain that piece to me, or I can go into it and look at this. We'll go into it.
They also said then, sorry, I missed it. Even though NHSN module is pre-populated with set dates for the vaccination. And that was Miss Jennifer Shores.
So Jennifer, are you reporting person level or are you reporting the aggregate way? Meaning, are you reporting this way by entering in the information this way, or are you reporting by entering the information in this person level way?
I'm waiting for the response.
First way. Okay, so you're doing the aggregate way. So the reason why I know that this is totally fine to do it the way that I've explained it, I know that this does show you these weeks of data collection, but that's just the week. That's just asking you, did you report in this week? And that's the reason that those dates are included there is so that from CDC side, from NHSN side, it's making sure that at some point in that week, you have reported data. It's not saying that that's going to be all of the data for that week, because if it was, you might potentially have to report every Sunday at 11:59 p.m., right? In order to get a full picture of that week. So while it took me a while to learn that you don't have to report on Sundays. Eventually, as I began to learn more and more about reporting, and we realized like, oh my gosh, so many people are coming in on a weekend when they normally wouldn't work to report this stuff because the way it was rolled out really made it seem that way. You definitely don't have to do that. I really wouldn't worry about, as long as you've got full week's worth of data, right? So even though right now is going to be just 3 days, if you make that switch, next week you'll kind of catch up with everything, right? Next week it will be 1 full week's of data because you'll do last week, like from the 13th through the 17th and looking at that snapshot of time. So it's really just making sure that you're not missing any days, which is why you don't want to miss, like if you just reported Sunday, still report this Wednesday. Don't miss it and say, okay, I just reported on the 10th. I'm not going to report to the 20th because I just did it on the 10th and I don't want to do it on the 13th again. That's not what you want to do, because again, it's not looking at like, it's not asking you how many more people got vaccinated in that period of time. It's asking you how many people total, right? So when you open this guy up, it's asking you how many total, not how many more from last week. So that's how you also know, like, you don't have to worry too much about what day of the week you do it, as long as you're doing it once every week. So I think that's a really good question though, and I'm sorry for not going over that initially, but yes, you don't have to worry about that Saturday through Sunday. It's more so making sure that you're not missing any residents that may have been in your facility. And it's only going to be weird for that first week when you switch your reporting day. After that, and your reporting day is the same, it'll feel really normal again. It's just that first initial one that's going to feel a little funky.
Thanks for that clarification. Before we conclude, I wanted to tell you about our next presentation. You can join us next time on March 27th, 2024 from 12 p.m. Central Standard Time to 1 p.m. or 1 p.m. Eastern Standard Time, where we're going to actually have a 2-part presentation. First, we'll have 2 guest speakers from the Institute of Healthcare Improvement, Miss Amanda Meyer and Miss Alice Bonner, that will be discussing how your facility can be more age-friendly for the first 10 minutes. Then we'll continue our FTAG series and be discussing F880, infection prevention and control, environmental services, laundry, and non-clinical citations and IPC, which will be presented by Ms. Jana and Patty Leonard. Our team is dedicated to providing valuable insights on these practical examples to support your facility, and these will be more non-clinical options, which is not always what we talk about. We often talk about the clinical, and they can be often overlooked and missed. So we want to discuss how EVS and laundry services, as well as any other most frequently cited areas in that portion of the IBC FTAG. You also will be able to view this recording on our YouTube channel. We'll start providing that link in our chat. Before you exit today, please click the link to the evaluation in the chat box to provide any feedback on today's session. This is your only opportunity to complete that evaluation, and we thank you for all participating and look forward to seeing you next time. Have a great day. Thank you, Miss Alina.
Thanks, everyone. Appreciate it.